Good day once again, Dr. Yakub is my name, Well-Life Hospital Abuja. Today we shall be talking about a viral infection called Human Papillomavirus and a disease it causes, which is genital warts. Now, genital warts it's a warty growth that occurs in genital areas as a result of an infection with a particular strain of human papillomavirus. Now, as a background, human papillomavirus is a sexually transmitted virus that is also usually associated with causation of cancer of the neck of the womb, that is cervical cancer. And there are usually 4 strains of it, 4 types of the virus. But the 4 types commonly, we have the one we call type 6, there is 11, there is 13, there is 18. Usually, the 16 and 11 are the types that cause genital warts. These warts can appear in the genital area, in the anal area, and sometimes around the oral area, depending on what form of sexual activities the individual engages upon. So if someone has human papillomavirus, those types 16 and 11, and engages in sexual activities, then that person can transmit the virus. And of course, you, the recipient, can contract the virus, especially if it is unprotected intercourse. Now, once the virus is contracted, how does it manifest? It manifests as warts. Warts are like cauliflower-like kind of growths, soft, fleshy growths that will occur in any part of this body that is engaged in, usually in intercourse. As I said before, oral, anal, or genital area directly. Usually when the warts occur, they don't cause any pain. They usually don't cause pain at all. And in most cases, they also occur when the immune system is not able to contain the virus. But because they do not usually cause pain, people don't usually present with the symptoms early enough until it becomes embarrassingly troublesome, in the sense that for some, by the time the warts appear little at the time, they hardly present. But by the time they present in a hospital, most of the time the warts have spread all over the place, especially if the warts are hidden in genital or anal area. But the ones that usually people may want to present early enough with are the oral warts, because if you have oral warts, of course, it's embarrassing. People will present early. But by and large, people don't usually present early with it until it is late. A lot of time too, people do not even identify that. They don't realize that these are warts. So if you see or experience any form of growths, small, fleshy, pimples-like kind of growths, but usually they're bigger than pimples, around your anal area, around your genital area, and you're not sure what exactly it is, perhaps it could be a genital wart. It's good you go to a healthcare provider who may identify what it is and then give you a solution. But as I said before, it's almost exclusively sexually transmitted. Now, when the warts appear, they also usually disappear on their own after like 4 to 6 months, whether you treat it or not. But the virus itself never really disappears from you. Usually the virus hides somewhere in your nervous system and waits for time and again to present. So every now and then, if you have the virus, you may see the warts coming on and off, whether you treat them or not. When you have warts, how do we treat it? Usually the first thing we want to know, knowing that the virus is sexually transmitted, and knowing that in most cases, it presents when your immune system is compromised, we like to also screen you for other related sexually transmitted infections, particularly HIV. In fact, some people who have HIV, the very first time they may realize they have HIV is when they present in the hospital with genital warts, especially the extensive ones, when they will now be screened and they will discover that actually, indeed, they have contracted HIV along the line, along with the HPV. So once you see genital warts appear in you, please don't take it lightly. It could be a manifestation of an immune system getting weak because of a co-infection with HIV or other conditions like diabetes or steroid use that have compromised your immune system to that extent. So we usually screen to find whether or not you have other coexisting conditions that may have predisposed you to getting the human papillomavirus or the manifestation of the warts. Now, once you don't have, and we see that it's clearly just a simple human papillomavirus infection, what is done for the warts? Usually there are various things that can be done to treat it. There are creams that can be applied on the warts, and usually they will disappear. Sometimes we do what is called cryotherapy. Cryotherapy is where you freeze the warts. And then other times, we also use electrocautery, which is using electricity or electric current to burn the wart. And then last but not the least is surgical excision. When the warts are large, sometimes we actually excise them surgically. But one thing we have to remember is the fact that removing the warts does not necessarily cure the virus which causes it. So you can be treated today and the warts could occur again the next time. So once you contract human papillomavirus infection, it never really disappears. Now, the last thing I want to say related to human papillomavirus is the fact that once you have seen warts, especially as a lady, now keep in mind the possibility that you have contracted human papillomavirus and the other strains that may manifest much later in life. That is, the strains that may cause you to have cervical cancer. So it will be important that every now and then you screen yourself for cancer of the cervix, whether or not the warts ever come back again. So it's important we take note of the fact that once you have warts, keep in mind the possibility that you have co-infection with HIV or you have other forms of human papillomavirus that may predispose you to cervical cancer later in life. Thank you.